Do you think increasing levels of mental stress causes high blood pressure? Do you feel that even if you don't consume enough amount of salt and still your blood pressure stays high? Do you think that once you have high blood pressure, you should stop exercise? If yes, this is a video for you. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Hypertension or high blood pressure means a persistently elevated resting blood pressure reading of more than 140 by 90 millimeter of mercury. Now remember this line because we'll be revolving our video around this statement itself. There are a lot of common myths that I come across frequently during my practice on high blood pressure. We'll be talking 5 most common myths and we'll be busting those myths and we'll be getting to know the facts and truths about those myths. Starting with myth number 1. Increasing levels of mental stress causes high blood pressure. Mental stress has nothing to do with your high blood pressure. Yes, we can agree upon that increasing mental stress might cause a temporary rise in blood pressure, but then it doesn't match with our definition of hypertension. That means a persistently elevated resting blood pressure. The blood pressure that rises during increased mental stress or increased spells of high emotions causes a rise in blood pressure that is temporary. And as soon as you are out of that mindset, your blood pressure falls back to normal. Myth number 2. Cutting down on salt intake will make your blood pressure normal. Absolutely no. Salt has a lot to do with blood pressure, but salt intake itself doesn't cause high blood pressure. I have discussed the same thing in my video on diabetes also, that increasing consumption of sugars don't cause diabetes. In the same way, increasing consumption of salt does not cause high blood pressure. So the question arises is then why are we told to decrease our salt intake when we are suffering from high blood pressure? Good question. The answer is that decreasing the salt intake will lead to a reduction in the medications that you are taking for high blood pressure. Also, there are several other consequences of increased salt intake. One of the major thing is increasing salt intake will cause increased body weight, that it causes obesity. We'll be talking about facts about obesity in our upcoming video, so stay tuned for that. But the fact here is salt consumption itself does not cause high blood pressure. Decreasing salt intake will only reduce the medications that you are taking for high blood pressure, and it becomes easy to control high blood pressure when you are taking low salt, but it primarily does not cause high blood pressure. Moving on to number 3, you should avoid exercise if you have high blood pressure. Now this is the worst you can do to your health. Stopping exercise will only worsen the levels of your blood pressure and not improve it. The ideal thing to do is to continue or to start exercising if you are not exercising. The ideal time ranges are 30 to 45 minutes of cardio exercise that should include either brisk walking, jogging, cycling or swimming, anything, for at least 5 days a week, if not every day. Sitting down and doing nothing and stopping your exercise will just make you die sooner. It's as simple as that. Moving forward to myth number 4. Once started, you cannot stop medications of high blood pressure because you get habituated to it. Completely wrong. The medications of high blood pressure are not addictive medications. You don't get addicted to the medicines of blood pressure, or even if you stop taking the medicines of high blood pressure, you don't feel cravings to consume them back. So you're not habituated to the medicines. The fact here is the medicines of the blood pressure, in the same way as diabetes, these medicines work only for around 24 to 48 hours after they have been consumed. So if you stop taking the medicines now, after 2 days, the effects of those medicines will wean off and your blood pressure will rise back to where it was, unless you haven't applied the necessary lifestyle modifications that are required to control your blood pressure. So I always advise my patients and to everyone around me that starting the medications for high blood pressure should be done only after it is confirmed that the patient is suffering from hypertension. And for that, what you need to do is we need to recheck or monitor the blood pressure regularly till at least 1 week. And if that patient falls into the criteria that I recently mentioned in the starting of this video, a persistently elevated resting blood pressure of more than 140/90. So if that patient has a reading of above 140/90 for straight 1 week of monitoring, then and then that patient should be given medications of high blood pressure. And the patient should always be counseled that these medications are to be taken for longer periods and not for a day or two. Moving forward to the last and the most common myth that I have come across regarding high blood pressure is myth number 5. I should not be taking the medicines for high blood pressure as I don't have any symptoms of high blood pressure. Now this is again the worst thing to do, because a high blood pressure levels of more than 140/90 or even say 160/100 will not be having any significant symptoms if the duration of blood pressure is short. So mark my words, if your blood pressure is rising slowly and steadily over years, you will not be having any symptoms. But a decade later, or 12 to 15 years later, your kidneys will be firing up, your vision will be affected, your heart and brain will start slowing down. These are the unwanted and hazardous consequences of high blood pressure, for which we doctors strictly keep our patients to continue the medications, or if the blood pressure is borderline, to monitor their blood pressure so that it doesn't rise above a certain level. So yes, taking a pill for hypertension is an individual choice. So if you don't want to take medicines for high blood pressure, it's completely a personal choice. But the reason for not taking medicines should not be an absence of symptoms. If you don't have symptoms, that does not mean you don't need medications. This is a fact, and this should always be kept in mind while you suffer from high blood pressure. So I hope all your doubts and questions about high blood pressure are now clear. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and critical care specialist, and you are watching Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.